Okay, this is the first or part one series of the pediatric musculoskeletal conditions. This particular part will be focusing on particular limb deficiencies. Overall, throughout this series on musculoskeletal conditions, I'm hoping that you can understand the different types of limb deficiencies that are out there. Um, we will be discussing osteogenesis imperfecta, or OI, scoliosis, JRA, or juvenile rheumatoid arthritis, and we'll be learning about the medical management and OT intervention for these limb deficiencies, perhaps what we do as OTs for osteogenesis imperfecta, scoliosis, and JRA. Um, We'll also be looking at some conditions very briefly, such as arthrogryposis. And I know we've looked at that in quite detail during one of our PBL cases. And so we'll be briefly going over some of that information. I think the key points to that diagnosis are the club foot and possibly even club hand, which I've seen fairly commonly in practice. So we'll be discussing those as well throughout the series. Looking at limb deficiencies and how they're caused, certainly they can be caused by something traumatic. Um, Perhaps there was a car accident or a farming accident. Perhaps there was something traumatic that happened, right? Where they're missing an arm or missing a leg or a finger, something along those lines. Because of our advances in surgical interventions and those sorts of things in the medical field, we're seeing less limb deficiencies caused by something traumatic because they are being reattached and so forth. We do see limb deficiencies caused by certain types of pathology. This may be related to some sort of physical illness. Maybe it's an infection that is spreading. There's certain types of cancers that affect the bone. Which we'll be talking about in a different lecture with childhood cancers. But basically, that limb would have to be amputated to prevent the spread of that infection or spread of that cancer. Congenital is something that I think is quite common when you're looking at limb deficiency causes. With congenital limb deficiencies, there's malformation in the hands and feet in approximately 1 out of 600 live births. So that's pretty common. I would venture to guess that many of you know somebody who has some sort of malformation in their hands and or feet. It may be something as simple as missing a finger, missing a joint, missing a toe, something along those lines. Again, with the limb deficiencies in OT, we saw that quite commonly in upper extremities. Again, missing a finger, having an extra finger. And we'll look at the different types of limb deficiencies as well. But again, as OTs, working with activities of daily living and handwriting and scissor skills and bilateral hand skills and dressing, a lot of times people were affected in those areas because of some problem, some limb deficiency with their upper extremity. Teratogens can be a cause of a limb deficiency, particularly when you're looking at if the mother is using drugs or she's exposed to certain viruses in utero, that can sometimes cause malformation of a limb as well as the child's developing. If the mother has a metabolic disease as that child is developing, such as diabetes, something along those lines, there's higher incidence of limb deficiencies as well. Congenital constricting bands is something that's kind of interesting. So this is where, for some reason, part of the fetus, the arms or legs or fingers, somehow get caught up in these amniotic bands while they're in utero. And so these amniotic bands is, that amniotic sac that the child's in as it's growing. Sometimes bits of that fall off, and they're very fibrous, and so they can get wrapped around a limb of a child, and then that child, as they grow, that band sort of constricts down in that area. It's kind of like if you tie a piece of yarn around your forearm, and you have your neighbor pull it really, really, really tight. Okay, now imagine if your arm were to get bigger and bigger and bigger as if it were developing, and that band wouldn't grow. Eventually what would happen is the circulation would be cut off, and they would either lose that limb, or there would be some significant scar tissue, and it would affect muscle development and blood vessel development and so forth. So that's out there as well, which is a unfortunate condition. So when we look at the different types of congenital limb deficiencies, so this is what children are born with. Amelia is kind of a term. Basically, A means without, right? And Amelia means limbs. So Amelia is when the child is born without one or more of their limbs. So without an arm, without a leg. Phocomelia is when they're missing that proximal portion of a particular limb or limbs. Okay, so some children may not be born with a humerus. Okay, that's proximal, but they may still have their hand. Okay, so their hand would sort of be up by their shoulder. Paraxial deficiency means that proximal part of the limb is developed, but maybe the medial or lateral side of the limb is missing. So for here, they may have the humerus part, right? But the radius or the ulna of their forearm may be missing. Transverse hemimelia is when a portion of the forearm or hand or parts of the fingers or all of the fingers are missing, because those fingers are that distal lower extremity. So some part of that distal lower extremity is missing. So we can see here different pictures or different examples where in phocomelia, again, we have no proximal part of the arm, so the humerus is missing, but they do have the distal part of their arm or their hands. Same thing with this particular person's legs. Okay. For paraxial deficiency, they have a normal part of their proximal arm. Okay, so here this particular child has their humerus, but you can sort of see as you're moving down distally, that limb is sort of underdeveloped here. You can see here, this is this kid's x-ray, so they're missing their hand, but they're also missing either their radius or their ulna. I'm guessing maybe radius by the look of the picture here. But so anyway, that's an example, or it could be an example of paraxial deficiency. This particular person, you can see at the very distal part of his hand, he's just missing a transverse section of it. And so this particular child has his humerus, has his radius and ulna, but he's missing that component of some of his fingers. It looks like maybe he has a thumb maybe, or an index finger or something like that, and he's missing that transverse part of his hand. So I would say this one's more transverse hemimelia as well. So, and certainly there's some gray area, right? With when you look at the definitions of paraxial deficiencies, proximal part of the limb is developed, but the medial or lateral side is missing. And so it looks like this part, the lateral part, here is missing, or medial part. So perhaps this guy could have paraxial deficiencies too. It's not always exactly black or white when we're looking at limb deficiencies, but hopefully this gives you sort of an example of how they're categorized and gives you some familiarity with the terms. So you can see here they're missing that distal part. Same thing, she's missing the distal part of her legs. And then you can see kind of the use of prosthetic or prosthetic devices as well, with the hook for the hand, those sorts of things. So just, again, some more examples. As I've briefly alluded to, the medical and OT management, you're going to be looking at prosthetics here, right? They say, research has shown that usually they will fit an upper extremity prosthesis, so a child that's been born without that upper extremity, by as early as 6 months of age. Because when we think of development, at 6 months of age, that child's starting to integrate and use their bilateral hands, right? And so if you have that prosthetic at that time of development, that child will sort of have that in their mind and be able to use that prosthesis to grow and develop with. A lower extremity prosthesis is usually administered or usually recommended at the time of ambulation. Okay, so as that child again is beginning to walk, which, you know, for some sources say around 10 to 12 months of age, somewhere in there, that's the time when they would be fit with a lower extremity prosthesis, so that they can kind of learn to grow with it and use it developmentally. I hope that makes sense. You'll want to consider the terminal devices. Terminal devices can range from maybe a hook for a hand or some type of pinchers, those sorts of things. And then you may want to consider the growing child as well, right? So, you know, when you're fitting a 6-month-old with an upper extremity prosthesis, you know, I'm hoping you wouldn't go with a hook, or I'm hoping you wouldn't go with some sort of pincher or something with a sharp end on it, but maybe something a little bit more subtle. So you'll want to consider that. Also, what's interesting, if a prosthesis is fitted after 2 years of age, there's a greater chance that that child's going to reject the prosthesis or just not use it at all for functional activities. So it's very important, and you can advocate as an OT to get that prosthesis, whether it's by a prosthetician, probably not an OT, but to get a prosthetician to help get this particular child a prosthesis so that it can affect their independence with functional tasks. So an OT intervention, you will want to, again, work with a prosthetician, somebody who has training in the different types of prosthesis or orthoses that is appropriate for that particular child. You'll want to work with them, right, in order to determine what's best and what's developmentally where that child's at, and encourage those functional activities, right? So as an OT, you're the expert in child development, and so if you're working with a prosthetician and a child who's 6 months of age, you're going to want to encourage just a very simple prosthesis, right? And when that gets fitted, your intervention activities should be focused at that bilateral activity, right? Batting at a balloon, reaching, holding a bottle, or stabilizing a bottle, those kinds of things. Of course, as that child grows, maybe you want to teach them how to don and doff and take care of their prosthesis, okay? Also, you'll want to teach them activities of daily living skills so that they can use their prosthesis to help increase their level of independence with dressing, grooming, hygiene, all of those kinds of things. And, you know, they're going to be changing their prosthesis as they grow. As they grow, they're going to be getting more responsibilities for ADLs, IEDLs, those kinds of things. And so you'll want to consider that as well. Here's some pictures of some terminal devices. Again, you have some that are, they can be quite complex, right, with moving parts and moving digits. You have some that are a little bit less complex, where they're more of the pinchers and the hooks that we're used to seeing, or that we may have all seen, or something that just may not necessarily be functional, but aesthetically looks real. So you may see some of or all of these.